Good morning, and welcome to the Georgia STEMCon Speaker Series and our Panel of Experts webinar. My name is Juan Cora, and I'm one of the board members of the Atlanta STEM Foundation. I'm quite excited about this opportunity to moderate this discussion, particularly with the caliber of professionals that we've assembled to engage us here today with their compelling backgrounds and fully anticipating some insightful exchanges. In fact, I should take a moment briefly to introduce each of them. To begin with, we have Dr. Angela Joshi, a non invasive general adult cardiologist with an emphasis on transthoracic and transesophageal echocardiography and the various stress testing modalities. Using her expertise in quality improvement and patient safety, she also works closely with the safety learning system to evaluate and develop safer and more effective patient care strategies. She graduated summa cum laude with a bachelor's degree both in chemistry and biology medical sciences from Mississippi College. Next, we have Miss Lindsay Riemann, a digital strategist, content manager, and social media specialist who has advised some of the most recognized brands around the world. She has 15 years of experience working with leaders of Fortune 500 organizations throughout the retail, financial technology, and healthcare space. Her focus has been in web development, SaaS, talent acquisition, consulting, sales, and account management. And finally, we have Mr. Gilberto Cintron, a supply chain software professional with 14 plus years of experience leading high performing teams in the design, development, deployment, and support of complex supply chain solutions. Gil has also amassed a wealth of experience across various business sectors where he has deployed his vast technical background and versatile leadership in several sectors, including military, defense, telecommunications, and network engineering, medical device manufacturing and distribution, and supply chain operations. Gil holds a degree in computer science with a concentration in electrical engineering technologies from Cleveland State University. So thank you and welcome to all of our panelists. Let's go ahead and begin. The Atlanta STEM Foundation has been recognized over the years for its outreach initiatives and programs that connect STEM and opportunity to the benefit of many disadvantaged communities. But one of the things that I'm most proud of is the Atlanta STEM Foundation's firm commitment to both recognizing and playing a pivotal role in working past the current moment. And while these challenges facing many of our communities have deep seated roots, which have laid bare some of the historic inequalities within the pandemic, we certainly recognize that STEM is the pathway forward. You see, STEM is the pathway forward on all matters that affect the current moment. And we believe it's the solution to getting our communities, our country, and our world back on track. And what a shining array of distinguished STEM professionals that we get to indulge with over this webinar. Let's talk about your backgrounds a bit, as I believe that's a great way of inspiring that sort of next generation, those Generation Zers and young adults on what's possible for them as they look to shape their own careers in STEM. So I'll begin with you, Dr. Joshi. Why don't you tell us about your background and how you decided on this field and what resources you've perhaps leveraged to arrive in your current role?
Absolutely. Thank you, Juan, for this introduction and the opportunity to participate in such an amazing platform. So a little background. I am the eldest born of 3 children to Indian immigrant parents, born and raised in Jackson, Mississippi, which is where I completed my primary and secondary education. And my track towards medicine really began from an early age as medicine started to be ingrained into me from a cultural respect. We also had some experiences with the healthcare field early on when my brother was diagnosed with cerebral palsy and working with him to get the resources that he needed. But that being said, my interest in medicine really peaked when I had an epiphany sitting in the 6th grade science lecture as we traced the pathway of blood through the heart. And then, it continued on into high school and college. And in college, I was fortunate enough to link up with a local and renowned cardiothoracic surgeon. So I was able to interview him and even shadow him into the operating room, which was quite an experience at that time for me. And then I found this volunteering program at our local medical school as well, where I shadowed to get some other experience in other specialties. And so then on, I actually went to the University of Mississippi Medical Center, where I completed medical school. And then after that, completed my internal medicine and cardiology training at Vanderbilt in Nashville. And here I am now, joined with Wellstar.
Wow, that's quite impressive for sure. Just in some of your points, being a first generation Indian American living in Mississippi during the 80s and 90s, with you mentioned, of course, a family member with a disability.
Mhm.
Do you feel you all had the same access to resources and support as others to further your aspirations as a family, your family objectives, etc.?
That's a very good question. And I felt that eventually we did get the same access to resources, but there were many obstacles to overcome, especially with trying to get the resources that my brother needed, outside of the hospital to lead a vision or quality of life. And so that was an experience. But I will tell you, the key is persistence as a pathway to succeed from that standpoint. As far as my education is concerned, I knew early on going into medicine, the grades had to be there. So all of the scholastic research volunteering endeavors I took place in, of course. But what's critical to me, and I would recommend, would be getting a key set of mentors, or even one mentor that can easily guide you in your career and path of life.
Excellent. Thank you, Dr. Joshi. It sounds like your family was quite persistent, and you definitely had some great role models, even in your parents, in that regard as well.
Absolutely.
How about you, Mr. Cintron? Talk to us a bit about your background, what resources you may have leveraged to help pursue your education that others might be able to consider.
Sure, Juan. So I was born and raised in Puerto Rico until about the age of 5. From there, my family's pursuit of greater opportunity took us to Cleveland, Ohio. In Cleveland, I grew up there most of my grade school years, all the way through my sophomore year of high school. From there, I went ahead and decided to go back to Puerto Rico, studied my 11th and 12th grade year there. And I really knew right at that point that I wanted to make sure to return back to the mainland and pursue my university studies in the U.S. So I went ahead and applied for a number of different universities. I wanted to make sure that staying as close to my home base as possible. So I kind of targeted the Midwest region, applied for Indiana University, Xavier University, Ohio State. And after receiving the different acceptance letters, I went ahead and pursued to start off at Ohio State University. Spent really the first year there at Ohio State, and unfortunately ran into some rather challenging financial hardships. And frankly speaking, I just didn't have the level of maturity at the time as well to kind of look for different avenues. So decided to take a bit of a hiatus, if you will, from university studying, and went ahead and started working. I did return back to Cleveland, Ohio at that point. And I had 2 very important experiences working in Cleveland. The first really was in a warehouse operations setting as a picker. And the second was working at RPS, what's currently known as FedEx Ground, as a parcel loader. And both of these jobs really didn't know at the time, but really played an instrumental role in my current career today. But while working at RPS, I started looking for opportunities to get into my university studies. And one of the most appealing one was ROTC, Army ROTC Scholarship. So I went ahead and applied for that, did all of the applications process, which was quite lengthy. but was finally awarded a scholarship. Studied at Cleveland State University with that scholarship. And I finished off with again, a Bachelor of Computer Science with a focus in electrical engineering and robotics. And from there, I was commissioned as a second lieutenant in the U.S. Army, served 4 years in the Signal Corps, and was deployed in support of Operation Enduring Freedom in Afghanistan, as well as Operation Iraqi Freedom in Kuwait and Iraq. And really, those 4 years in the military really served me extremely well. They were critical to developing myself as a technical leader and really giving me that base that I currently have today, which I apply across everything I do.
Thank you, and thank you again for your service, Mr. Cintron. I know the military has played such a critical role to help many disadvantaged youth receive the resources that they need in order to really start their careers and get the types of on-the-job training that in many respects the military provides them. So, but thank you.
Absolutely.
And last but not least, certainly not least, Ms. Riemann, perhaps you can tell us about your background and some of the obstacles that overcome in order to land at this career.
Okay. So I'm Lindsay Riemann. I was born and raised in Pennsylvania, and I went to Penn State in the early 2000s studying telecommunications. I recognized in my first 23 years that I grew up in a very homogenous environment. Everybody looked like me, everybody looked like each other, and I knew I wanted to break out of that. So obstacles related to that, I want to focus on both self-imposed obstacles, which is really what I kind of struggle with, and trying to manage being fearless in some instances and then being gripped by fear in others, like presenting at a virtual panel discussion. That would be something where I'm really out of my comfort zone, but just making sure that even though it makes my throat clench and I don't want to do it, I enthusiastically say, yeah, I'll participate. So it kind of manifests itself in different ways. I wasn't scared enough once I knew I wanted to leave Pennsylvania, to move to New York with, I think, about $1,000 in my pocket. So I can, I'm not scared to make big changes. And I guess the fear can sometimes come in where I'm just not capitalizing on the opportunities within my organization where I can have roles or more visibility and take opportunities to kind of be my own proponent and lead meetings or strategies. I'm kind of just oftentimes too happy to sit in the background and contribute to somebody else instead of just contributing, for myself or advocating for myself.
Got it. Well, you're doing great, certainly as part of this virtual meeting, and we definitely appreciate your participation. So excellent. Again, I'm always just so inspired to hear about these varying backgrounds from such talented professionals. And I do believe that many young folks will be able to relate and certainly be encouraged to similarly, give wings to many of their aspirations, despite some of the challenges and obstacles and perhaps even trials that they may face. So I'd like to pivot a bit here, if you all don't mind, to talk a little bit about the pandemic. Certainly this pandemic has uprooted our lives. It's impacted our communities in ways that are truly unprecedented. And I'd like to discuss how you all see the pandemic affecting your companies, industries, and perhaps the roles that you've been playing at work over the last 7 months. So Mr. Cintron, let's start with you. Supply chains have become such a critical component to the COVID response. How have enterprises, in your opinion, across the world, mitigated the disruption to their supply chains over the last 7 months?
That's a great question, Juan. In response to the pandemic, many businesses really have had to find themselves in a position where they have to reinvent themselves very much from the ground up. They've had to re-architect their supply chain solutions, their supply chain capabilities, and essentially the technologies they use to function in that capacity. There's different behaviors, different consumer expectations. One specific example that I'd like to call out is really the demand that consumers have had on all businesses as it relates to curbside and contactless pickup. So those companies that are essentially fulfilling consumer needs have had to adjust their models to accommodate for curbside and contactless pickup. Pretty major change, and they had to deploy that very, very quickly. Another good example is simply in the warehousing operations and distribution centers and warehousing facilities. Doesn't really matter the size, doesn't really matter the function or the vertical. If you're in that setting, those companies, those warehousing distribution center facilities have had to adapt and optimize their current workflows to accommodate responsible social distancing practices. Could be as simple as making sure that they're not having more than 3 pickers in a specific picking line. But it's a change, and it's a change that they had to deploy very, very quickly. And another really good example is really the need to revisit how these businesses have been facing the different consumer needs, the ordering, if you will. A lot of businesses, traditional companies that have been more brick and mortar type companies, have had to very quickly shift to accommodate online shopping. And they've had to introduce specific workflows to accommodate that e-commerce move. And this has been very, very important, specifically with the COVID, right? Because as these stores have closed down temporarily, these businesses have had to keep up with that demand. And then one final point I would say is just those businesses that have adopted omni-channel order management type solutions that would allow for very flexible control of their inventory have seen a lot of success as well. Just because, again, these solutions, omni-channel solutions, allow them to very quickly adapt to those changing situations that the pandemic has presented to their business.
That's great to hear. I think it definitely gives the consumer the confidence that many of these supply chain and distribution networks will continue to bear out through the pandemic. Certainly these same enterprises have been relying more heavily on social media to continue to get their message to consumers, as well as staying connected within their organizations. Ms. Riemann, I would imagine social media has evolved considerably during the last 7 months of the pandemic. How have you seen your role shift?
So it's really been about changing the conversation. The conversation before was all about Manhattan products and how we're solving problems, and we're going to do it to X percentage, and it's turned into a more listening and responding, and the content that I produce is much more storytelling. It has a lot more to do with the news, because the news is now, retailers are going bankrupt or stores are closing, and it's all negativity. But it's our messaging is about now our customer stories and their wins, and we try and communicate those stories and those achievements to uplift everybody kind of in the industry by highlighting their successes. And of course, the product messaging still works in there, but it's told in a greatly different way that perhaps gives hope or educates people that have a business type that's struggling, and they get to see how other companies are not just surviving but thriving during the pandemic.
Excellent. No, I could definitely see that as being a useful and strategic in many ways tool. Certainly one of the more visible impacts of the pandemic that all of us were privy to was the onslaught on our medical class as we scrambled, or as they scrambled, the rightful hospital readiness and ensure that it was fully attained to respond to this virus that at the time was novel in many respects. Dr. Joshi, how has the pandemic changed how you approach your job?
Sure, absolutely. I think that's such a great question. Change, of course, it has brought among many fronts, but I think the biggest and most obvious change has been the use of personal protective equipment, or PPE. We in the healthcare field have been no strangers to the use of PPE, but I think the consistent and the constant use of it from 12 to 15-hour shifts is what we had to mostly adapt to. Almost felt like really a scene out of a sci-fi movie, because you saw people anywhere wearing masks, face shields, all the way to hazmat suits. So it was quite an interesting experience that we quickly had to really use as our new norm, quite honestly. But the one thing I will say that did not change was, of course, the way and our ability to provide patient care, no matter what the environment and the resources we had.
I can't even imagine. And I certainly think that I speak for all of us in thanking you and your colleagues for your service to our communities during such a trying time. Perhaps you can elaborate a bit on some of the lessons learned in the medical community in these last 7 months that perhaps weren't quite as obvious initially, given the novel nature of the virus.
Absolutely. Our knowledge about coronavirus is ever evolving and will continue to do so until we learn, quite the intricacies of what all the virus is, and as it continues to change in its patterns. So I think the treatment strategies that we focused on early on, including the use of hydroxychloroquine and early ventilation strategies, have certainly gone mostly by the wayside. Been focusing more on the use of high-dose steroids, remdesivir and convalescent plasma, which we've all heard about in the news lately. And then focusing on really going back to a tincture of time and giving patients and their lungs and their bodies time to heal. I think that's been the most important and trying time for us as healthcare workers, is to give them time to, where we're so used to, let's do something and have them improve. This has been the most difficult part of that. And I think will continue to change as we learn more and more about the virus, and especially as a vaccine is being developed for that as well.
Excellent. No, and you can definitely see the tangible results of a lot of those lessons learned when you look at the sort of the mortality rate at the beginning of this pandemic versus what we're sitting at right now. It's truly impressive to see, some of the gains that have been made by the medical class and others, obviously researchers, et cetera, that are looking into the virus and best ways to mitigate and provide therapeutics and so forth. So it's impressive, definitely, to look back, again at the last 7 months. The things that we've learned from the disruption that the pandemic has had on all our lives. But as with most disruptions, the changes, and many times cataclysmic changes that our communities have experienced, I think have also provided a good number of opportunities, especially for STEM industries and careers. So Ms. Riemann, with all the disruption COVID has brought, what opportunities do you believe may exist within the current context that may be capitalized on by enterprises in their use of social?
Mhm. So everything is virtual now, and I think it's so easy that everybody can feel disconnected from your work, from your team. Productivity might be going down. You have less job satisfaction, and the opportunity that lies within organizations, social engagement and employee advocacy is, how do you communicate your work culture when nobody's in the office? How do you continue to engage your employees or make them feel connected when nobody's in the office? So I think the opportunity is with sharing more employee generated content, that we still feel connected to each other, and highlighting individual or team successes in a public forum, where maybe it would just be a team party where John Smith gets told he was the best engineer of the quarter. But now let's do that publicly and uplift all of our employees. So it works on maintaining a sense of employee culture, and then retaining the talent that you have because they're more engaged and happy with their work. That will translate into helping an organization recruit better talent, because you can see what it's like to work there. Everybody's remote, and you're still seeing all of this pride and enjoyment, or people having fun at work. So I think it's not enough organizations are seizing on that opportunity and being able to keep up with the employee engagement content. But once you are using that as a tactic, that then will translate over into business and sales, and that you're humanizing your organization. When you're encouraging employees to have, you know, a public presence about Manhattan and celebrate each other or your team successes or your products, it adds a lot of credibility to what Manhattan is doing when it's not just a corporate marketing message, and instead it's human to human, person to person, in ways that I just don't think were used before. We were all in person and in the office.
Yeah. No, that's fascinating. I mean, on the one hand, you have the sort of the effects of the pandemic, which lead to sort of physical separation of coworkers that obviously could have broader impacts on things like cohesiveness and team building, collaboration, etc. On the other hand, you then leverage social as a strategic tool to really humanize work, bring teams together, allow for the rightful collaboration and engagement, and frankly, improve productivity levels and ensure the type of business success that we're all after. So that's a fascinating perspective to look at social. And of course, that in many respects underscores the importance of having a flourishing technology sector to really buttress those digital platforms. I think on that vein, Mr. Cintron, where do you think the broader technology industry is headed, particularly as we embrace the new normal that COVID is bringing us?
Great question, Juan. As we know it, the technology landscape is always in flux. What we've been seeing here more recently is really that it's in hyperdrive. It needs to be in hyperdrive, and that's exactly what we've been observing. The need for technological innovation today is greater than ever. The challenges the pandemic has presented are ever more disruptive, I think ever more disruptive than we could have imagined. And one thing that for sure stands out is that we're seeing businesses across the board moving their solutions from a traditional on-premise deployment to the cloud. Organizations are embracing the power of the cloud and not only the power, but also the benefits that the cloud-based technologies provide them. The advantages are numerous. Just to mention a few, again, security is improved, sizable cost reductions, and probably speed to deployment. How quickly can you deploy innovation and technology? Leveraging the cloud, you can do so that much quicker. And these ingredients really serve a really important purpose for our fight against COVID. Another good example I'd highlight would be automation and robotics. Just yet another one of those technological areas that's top of mind for many. And there's short-term and long-term benefits here, specifically considering the pandemic and the challenges it brings our way. Having automation and robotics at play really allows us to, again, socially distance our workforce and reap the benefits of having robotics and automation play into that. Another area of focus, I'd say, is smart devices. I think smart devices and the technology we're developing on those smart devices is also playing a critical role, specifically with the fight against COVID. It's really very much at the tip of the spear, so to speak. Just rolling out smart devices that are very easy to use, that integrate multiple systems is absolutely top priority for all of us. And then finally, I would highlight machine learning, artificial intelligence, as well as deep learning. These three play hand in hand with maximizing, again, the businesses and how we understand consumer behavior, consumer spending, the trends, and how we personalize and make sure that we're providing the very best possible experience to those consumers.
Absolutely. I would imagine there's plenty to be gleaned from an analytics standpoint with respect to shifts and trends and the consumer behavior over the last 7 months that would differ from what we had seen prior to that. So definitely true. Dr. Joshi, what opportunities has the pandemic presented the medical field that you believe can be capitalized on for improved delivery of your services?
I think there have been many opportunities, but I think the most significant opportunity has been the rapid uptick in the use of virtual health measures. We know medicine exists and has been increasing in demand, honestly, in the last few years. But the rapidity with which it's really taken off since the onset of the pandemic has certainly been exponential, to say the least. It has allowed us to not only take care of our outpatient clinic patients while they're in the safety of their own environment, reducing exposure to themselves and others, but it's also translated into the inpatient environment, honestly, where we're taking care of critically ill hospitalized patients. And I think without it, we would be in a bind, honestly. And it's certainly that I can say with some measure of certainty that it's here to stay, and we're going to continue to see growth in this field, which, honestly provides another avenue to practice medicine.
Yeah, and to be honest, I mean, not only is that going to be beneficial, during the days of pandemic, the reality is that there are absolutely communities in our country and certainly scattered across the world that are much more rural and tougher to be able to access. And so when you look at things like finding a specialist for a specific, type of condition that a child may have, or an elderly person, et cetera, if they don't happen to have those specialists in their localities based on how remote they happen to be, then telemedicine allows for that level of closeness, and really eliminating sort of the space and time concerns behind that. So I absolutely can see that as being a direct positive to the investments that are being made currently because of the pandemic. Well, everybody, it has been an absolute delight to moderate this discussion with all of you. I want to first thank you for availing yourself to participate in this panel of experts webinar and exchange all these insightful, ideas and experiences, and certainly for your broader support of the Atlanta STEM Foundation. Each of you have a compelling story to be shared around developing your own STEM careers, and I know that many of those that might be tuning in will also be inspired and certainly leverage your insights in a manner that would help them create their own stories as they make decisions about their careers and professions. So thank you all, and let's continue to live out STEM as the pathway forward.
Thank you.